Hello, I'm Dr. Aletha, a urologist, and today I want to have a serious and straightforward conversation with you. If you're a man over 60 and you've noticed that your moments of climax feel different, where you experience the sensation of pleasure but little or no semen appears, this message is important. Maybe it happened once and left you worried, or perhaps it's become a recurring issue you've kept quiet about because of embarrassment or fear. I want you to know that you're not alone, and this change doesn't automatically mean you've lost your masculinity or sexual ability. It can be a sign that something in the normal process of ejaculation has changed, and understanding the cause is the first step toward finding the right solution. Before we talk about why this happens, it's important to understand what normally occurs during ejaculation. The testicles produce sperm, while the seminal vesicles and prostate contribute the fluids that make up most of semen. During climax, nerves and muscles work together in a highly coordinated process to move that fluid through the urethra and out of the body. But here's something many men don't realize. Orgasm and ejaculation are not exactly the same thing. Orgasm is the intense, pleasurable sensation controlled by the brain and nervous system, while ejaculation is the physical release of semen. Most men experience them at the same time, but they're actually separate processes. That's why a man can still experience a normal orgasm even when little or no semen comes out. When this happens, it's often referred to as dry ejaculation. You may feel the familiar pleasure of climax, but when you look afterward, there's little or no semen. Understandably, many men describe this as an empty orgasm, and that can create a lot of anxiety. But the important point is this: if you can still experience sexual pleasure and orgasm, the neurological part of the process may still be functioning normally. The problem may instead involve the mechanical pathway that allows semen to leave the body. And there are several possible reasons for that. One of the most common causes is retrograde ejaculation. Imagine a small valve at the opening of the bladder. During ejaculation, that valve should close, so semen is directed forward and out through the penis. If it doesn't close properly, the semen can travel backward into the bladder instead. You still experience the sensation of orgasm, but little or no fluid comes out. One clue can be cloudy urine after sexual activity because semen may have mixed with the urine. Retrograde ejaculation can occur for several reasons. Certain prostate or bladder surgeries, particularly procedures performed for an enlarged prostate, can affect the nerves or muscles responsible for this valve. Some medications can also interfere with the normal function of the bladder neck. Long-standing diabetes and certain neurological conditions can affect the nerve signals that coordinate ejaculation as well. I remember a patient who became extremely distressed after prostate surgery because his ejaculation had suddenly changed. Once he understood that the surgery had altered the mechanics of ejaculation, rather than eliminating his sexual desire or ability to experience pleasure, much of his anxiety disappeared. In many cases, a simple urine test performed shortly after orgasm can help a doctor determine whether semen is being redirected into the bladder. While this can affect fertility, it doesn't necessarily prevent a man from having a satisfying intimate life. Another possible cause is a blockage in the ducts that carry semen. The seminal vesicles, located behind the bladder, produce a large portion of the fluid that makes up semen. If the ducts connecting these structures become blocked, semen volume can become extremely low or disappear even though the body is still producing it. Think of it like a road that's suddenly blocked. The traffic may still exist, but it can't reach its destination. These blockages can sometimes develop after infections or inflammation that leave scar tissue. Small stones, cysts, or other structural changes can also interfere with the normal pathway. Some men may notice pelvic discomfort during orgasm or a gradual change in the amount and consistency of their semen. Depending on the suspected cause, a doctor may recommend imaging, such as a transrectal ultrasound, to examine the seminal vesicles and ejaculatory ducts. In certain cases, treating an underlying infection or addressing the obstruction with a minimally invasive procedure may help restore normal flow. Hormonal factors are another area worth considering, particularly testosterone. Testosterone plays an important role in male reproductive function, influencing sexual desire and sperm production, and supporting the function of reproductive tissues. When testosterone levels become significantly low, several aspects of sexual function can change. A man may notice reduced semen volume, lower libido, less firm erections, or changes in the intensity of orgasm. He may also experience symptoms such as fatigue, reduced muscle mass, or mood changes. It's important not to automatically assume that these symptoms are simply an unavoidable part of getting older. Sometimes they can be related to a medical condition involving low testosterone. A doctor can evaluate symptoms and use appropriate blood testing to determine whether a hormonal problem is present. If a deficiency is confirmed, treatment depends on the underlying cause and should be guided by a qualified healthcare professional. Now, I also want to discuss something important that many men overlook. Although dry ejaculation can have relatively straightforward explanations, a sudden or unexplained change should still be evaluated, particularly when other symptoms are present. Certain urological conditions can interfere with the ducts involved in ejaculation. In some cases, cancers affecting the prostate or bladder may cause obstruction or other changes in urinary and reproductive function. Blood in the urine or semen, persistent pelvic pain, or significant urinary changes should never simply be ignored. Neurological problems can also interfere with the communication between the brain, nerves, and reproductive system. Conditions that affect the nervous system, as well as nerve damage associated with poorly controlled diabetes, can sometimes contribute to sexual and ejaculatory dysfunction. This is why the surrounding symptoms matter just as much as the absence of semen itself. So, when should you seek medical attention? If dry ejaculation appears suddenly without an obvious explanation, especially if it's accompanied by pain, blood, fever, significant urinary symptoms, or a loss of sensation in the genital area, don't simply wait and hope it disappears. These symptoms deserve prompt medical evaluation. A urologist can review your medications, medical history, previous surgeries, symptoms, and, when necessary, perform tests to identify what's actually happening. And there's another part of this conversation that deserves just as much attention: the emotional impact. Many men grow up believing that ejaculation is proof of sexual performance, fertility, or masculinity. So when semen suddenly disappears, they may feel embarrassed, anxious, or incomplete. Some even begin avoiding intimacy because they're afraid their partner will notice or judge them. But your sexual worth is not measured by the amount of fluid produced during ejaculation. Your ability to experience intimacy, pleasure, affection, and connection involves far more than that. Understanding what's happening can take away much of the fear. If you can still experience orgasm, that doesn't mean your sexual life is over. And even when ejaculation has changed permanently after a medical procedure, many men continue to have satisfying and meaningful intimate relationships. Honest communication with your partner can also make a tremendous difference. Instead of silently carrying the worry, explain what you've noticed and talk about it together. And if you're concerned, speak with a healthcare professional rather than trying to diagnose yourself. There are also some practical steps every man can take. First, don't ignore a persistent or sudden change in ejaculation. If something has changed, especially after surgery, starting a new medication, or developing other symptoms, tell your doctor. Second, take chronic conditions seriously. Problems such as diabetes and high blood pressure can affect blood vessels and nerves over time, which can influence sexual function. Keeping these conditions properly managed is an important part of protecting your overall health. Third, don't underestimate the basics. Regular physical activity, a balanced diet, adequate sleep, and maintaining a healthy weight support cardiovascular, metabolic, and sexual health. These habits won't fix every cause of dry ejaculation, but they can support the systems your body depends on for healthy sexual function. And finally, don't let embarrassment keep you from asking questions. Urologists deal with these concerns every day. What feels uncomfortable to discuss is often a completely routine medical issue for a specialist. The most important message I want you to remember is that the absence of semen during orgasm is not automatically the end of your intimate life, and it is not a measurement of your masculinity. It is a change that deserves to be understood. The cause could involve the bladder neck, a blockage, medications, hormonal factors, surgery, or the nervous system. Once the cause is identified, your doctor can determine whether treatment, medication adjustment, further testing, or simply reassurance is appropriate. I've seen how much relief men can feel once they finally understand what's happening inside their bodies. The fear often comes from uncertainty. When you have a clear explanation and a plan, you can regain confidence and stop allowing embarrassment to control your life. Your vitality isn't measured in milliliters of semen. It's reflected in your overall health, your well-being, your confidence, and your ability to enjoy meaningful relationships and intimacy. So if you've noticed this change, don't panic and don't suffer in silence. Pay attention to your symptoms, talk openly with your doctor, and get the right evaluation if the change is persistent or unexplained. Getting answers can give you something far more valuable than reassurance. It can give you control. If you found this information helpful, share it with a friend, father, or brother who may be experiencing the same concern but feels too embarrassed to talk about it. And if you want more straightforward, evidence-informed information about men's health, prostate health, sexual wellness, and healthy aging, subscribe to the channel and turn on notifications. Remember, taking care of your health isn't just about living longer. It's about living well, staying informed, and being proactive about the changes your body is showing you. I'm Dr. Aletha, and remember, your best years can still be ahead of you.